Hello and welcome. Today, we're delving into a rare and often perplexing condition known as eosinophilic cystitis. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Understanding this condition can empower both patients and healthcare professionals to better navigate its challenges. The precise cause of eosinophilic cystitis, or EC, remains elusive in many cases. However, several factors are believed to play a significant role in its development. These include allergic reactions to medications, foods, or environmental triggers. Certain infections, both bacterial and parasitic, have also been implicated. Additionally, some cases are associated with underlying systemic diseases or bladder trauma. In some instances, no identifiable cause is found, which is then classified as idiopathic EC. The underlying mechanism of eosinophilic cystitis involves an abnormal accumulation of eosinophils, a type of white blood cell within the bladder wall. These eosinophils release inflammatory mediators, leading to tissue damage and bladder dysfunction. The inflammation causes thickening of the bladder wall, reduces bladder capacity, and disrupts normal bladder function. This inflammatory process is what gives rise to the characteristic symptoms of the condition. Eosinophilic cystitis is a relatively rare condition. Because of its rarity, exact epidemiological data is limited, and incidence rates are difficult to determine accurately. It can affect individuals of all ages, including children and adults, though it appears to be more commonly diagnosed in adults. There does not appear to be a strong gender predilection, although some studies suggest a slightly higher incidence in males compared to females. The rarity of the condition also means that diagnosis is often delayed. The symptoms of eosinophilic cystitis can vary in severity, ranging from mild discomfort to debilitating pain. Common symptoms include frequent urination, urgency, and nocturia, needing to urinate frequently at night. Dysuria, or painful urination, is also a prevalent symptom. In some cases, patients may experience hematuria, the presence of blood in the urine. More severe cases can lead to bladder spasms, suprapubic pain, and even urinary retention, where the bladder is unable to empty completely. Diagnosing eosinophilic cystitis requires a thorough evaluation, including a detailed medical history and physical examination. Urinalysis is typically performed to check for blood or infection. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, is essential for visualizing the bladder lining and obtaining biopsies. The biopsy samples are then examined under a microscope to confirm the presence of eosinophils in the bladder wall. Ruling out other conditions, such as bladder cancer or infection, is also crucial in the diagnostic process. While eosinophilic cystitis doesn't have formally defined subtypes in the way some other diseases do, it can be broadly categorized based on its underlying cause. Cases can be classified as idiopathic, meaning the cause is unknown, or secondary, where a specific trigger or underlying condition is identified. The extent of bladder wall involvement can also be used to describe the condition, ranging from localized to diffuse involvement. Treatment for eosinophilic cystitis focuses on managing symptoms and reducing inflammation. Conservative measures, such as dietary modifications to avoid potential allergens, may be helpful. Medications commonly used include antihistamines, corticosteroids, and mast cell stabilizers to reduce inflammation and allergic reactions. In severe cases, surgical interventions such as transurethral resection of the bladder wall may be necessary to remove affected tissue and improve bladder function. Intravesical therapies, involving direct installation of medications into the bladder, are also sometimes used. The choice of treatment depends on the severity of symptoms and the underlying cause of the condition. As the exact cause of eosinophilic cystitis is often unknown, prevention strategies are limited. However, identifying and avoiding potential allergens or triggers can be helpful. Managing underlying medical conditions and promptly treating infections may also reduce the risk. Maintaining good hygiene and practicing safe sexual practices can help prevent infections that may contribute to the condition. The prognosis for eosinophilic cystitis varies depending on the severity of the condition and the response to treatment. Many patients experience significant improvement with appropriate management, although relapses can occur. Long-term follow-up is often necessary to monitor for recurrence and manage any persistent symptoms. Research continues to explore the underlying mechanisms of eosinophilic cystitis and develop more effective treatment strategies. Recent studies are investigating the role of specific inflammatory mediators and potential targeted therapies to reduce inflammation and improve bladder function. Emerging research is also focusing on identifying biomarkers that can aid in early diagnosis and predict treatment response. While eosinophilic cystitis can be a challenging condition, Ongoing research and advancements in treatment offer hope for improved outcomes and a better quality of life for affected individuals.